Welcome back, and before we go on to the break, we are having a very interesting conversation regarding recruiting the young people and engaging them in their intellectual faculties. But Shahzad, do you remember a few days ago we went to a very specialized hospital that was just on the outskirts of the Islamabad.
Yep. And I loved every bit of being there.
Yes, and they had a very advanced sort of a machinery, and obviously the good part is that they are serving the marginalized communities there and making sure that they're contributing their part in making the access towards the healthcare a more universal concept, and which should not be excluded of the minorities and the poor people out there. And of course, we are talking about Islamabad Diabetes Center in the first place. We had a wonderful interview there. We looked at the machineries there, and we looked out at how they're actually tackling the diabetes in Pakistan, and especially in the South Asia, because it is one of the very emerging challenge when we talk about the diabetes.
Because Pakistan, ladies and gentlemen, unfortunately was ranked at #1, when we speak about diabetes prevalence over here inside the country, all over the world, and it is alarming. But, the best part was that 60% of all the patients who actually come to the diabetes center, ladies and gentlemen, are treated free. They are given free medicines, insulin, consultation, maybe anything. And I think that's something which we certainly would want to talk about, that how do you think such hospitals really work? And we're very lucky that we've been joined by one of the most handsomest chief executive officers that I've ever come across in my life, ladies and gentlemen. He happens to be the chief executive officer, as I've mentioned, of the Diabetes Center Pakistan and Overseas Chapter. He is Mr. Meesaq Arif. Hello, sir. Assalamu alaikum. Good morning. How are you feeling today?
Thank you very much. Thank you very much. I'm feeling very good.
And thank you so much, sir, for joining us. Wonderful to have you over here. So, the question is very basic over here. Since you happen to be the chief executive officer, and, it's not that a long time has passed by that you've been the chief executive officer of this particular hospital. But sir, what is the concept of such hospitals where we say that 60% of all of those patients who are going to come in will be treated for free, and how does it work?
Yeah, thank you very much for inviting me to this lovely forum. First of all, I would like to appreciate PTV World for doing a commendable service. You are being viewed all across the globe, and the tremendous viewers list, and I am one of the strongest fan of the program. That's my congratulations to you.
It's an honor, sir. Thank you.
Thank you. The concept of the diabetes hospital and the charity hospital, it's not new. It's all over the world. We have already many organizations in Pakistan which are based on charity, and it's the community service. Similarly, like we have some Idi Trust, we have Shaukat Khanam, but Shaukat Khanam is a cancer specialized. The diabetes hospital is first of its kind in Pakistan, which is taking care of the diabetic patients and related diseases which are caused due to the diabetes. Now, the question that the concept of the charity, and we are 60%, the patient that we are taking care of, or they are fed or they are sponsored by the Zakat fund, that we get the donation from the Zakat fund. And we are Sharia compliant. All those patients, those who we are giving the free treatment from the Zakat fund, they are basically scrutinized by the Zakat committee sitting in our office. And that makes us the system transparent. That makes the system more streamlined, and only those patients get care who are actually a deserving class. So 60% of the patients are being taken care through Zakat, through donations, and a free treatment.
Wonderful. And sir, with such models, we've always seen that there are always international collaborations or international donors as well. So obviously having a Sharia committee within people who are going to identify whether somebody is needy or not, that's something very different. But when we move on to international collaborations, when we talk about the overseas chapter, obviously we have a lot of Pakistanis who have such big hearts who are always out there to help people. So how do they contribute to this cause?
Yeah, again, a very, very pertinent question.
And how to mobilize their support in the first place?
Yeah, that makes us sustainable.
Yeah.
And that's very important, that, like I said, we are a diabetes center, Pakistan and Overseas Chapter, that I am the CEO. The main hospital is on the Murray Expressway. It's about 10 canals area, over 130 staff that we have, a specialized doctor. We have a spokes model. We have a hub. We have a spokes in the GT Road, DHA. We have a hospital. We have in G8. We have in Lahore. We have in Sahiwal.
Faisalabad,
now, apart from the local establishment, we definitely need support from the donors from abroad, expats, diaspora. So we have a TDC established setups in UK.
Okay.
We have a setup in Australia. We have a setup in USA. We have a setup in UAE.
Wow.
So all these segments, the TDC segments abroad, they regularly promote the cause of this donation in the charity hospital. They promote and it's to support this through fundraising events, and not only the expats or the diaspora is supporting through donation, through charity, but even the local community of the area is also supporting. There's huge money coming in. The hospital the Saiwal Hospital is a huge setup that is coming up. We are likely to inaugurate the foundation ceremony in the end September, the first week of October.
Wonderful.
It's over a 2 billion project, and the entire hospital is being financed by
The overseas-
TDC, the Diabetic Center, Australia.
Wow.
Wonderful.
The last on the 5th August, they had a fundraising event in the Brisbane, and I think over $100,000 was collected. So those people sitting abroad, their generous donation is making us sustainable and moving on with the operation.
Wow.
And obviously, the projects of such huge scales are not without their own sets of challenges in the first place, right? So if someone wants to follow your footsteps, because obviously we have a lots of prevalence of the diseases in Pakistan, unfortunately, and if someone wants to follow your footsteps, what are the challenges that you encountered, and how do you make sure that there is no hindrance in your way of smooth functioning in the first place?
I think the most important thing is that the TDC, the diabetes hospital and its specialty, this has to go public. It has to go live. We have to outreach to the people. We have to tell them what we are serving, what we are delivering. The biggest challenge is the marketing that we don't have. People are unaware about the diabetes and its related issues. The biggest challenge is unawareness about the masses.
True.
As you already mentioned, that the Pakistan is, if nothing else, but it is ranking on one of the top slots in the diabetes. This is so unfortunate.
True.
It's not because that we don't have the resources. It's not that we don't have the will to go forward to combat this menace, but we need to tell people. People need to know it, that this is a diabetes, this is a serious disease, it's a root cause to all related
and the
issues.
awareness needs to be out there. But there's one technical question which I would certainly want you to kind of shed light on, and that is that, when we speak of such a charitable service or such hospitals, what happens is that usually, because with diabetes there's so many other complications, with eyes, with your feet, with your organs, so it affects the entire body. Now what happens is that it might be the situation that at times you might not have the right expertise to kind of treat that gentleman or that lady who is presented with whatever symptoms, so do you think that when we speak of TDC, they are going to look forward to other venturing or probably discussing their cases with other doctors and other hospitals and experts from all over the world, or is it just going to be whatever facility you get within that hospital and that premises?
Yeah, very, very nice question, very pertinent. Yes, the concept to establish the diabetes center is to have a specialized hospital in the diabetes.
True.
And its related diseases.
Yeah.
Now, what are the related diseases? Somebody is a diabetes, then diabetes is the root cause to affect the kidneys.
Yep.
It's a root cause to affect your eyesight. It's, so we are addressing all those areas which are related to which area is affected due to the diabetes. We are now expanding ourselves to going into gestation, the pregnancy. We are going to the type 1 diabetes, that is the diabetes in the children.
Yep.
Right.
And the vascular surgery that we are doing. So all these related diseases are being addressed. We have a qualified, specialized doctors available 24/7, and we are treating. Trust me, it's so satisfying that we are providing a service to the humanity.
And I've been in conversation with a lot of patients from your hospital, to be very honest, and I'll be very honest over here that where credit is due, it's due. And they were really happy of the fact that imagine that there have been people who've been treated for the last 10 years, 5 years, free medicines, and free consultations. Every single time they have a problem, ladies and gentlemen, they show up at the hospital, they're being treated just like they've treated us and our entire team. So there was no difference amongst them. The SOPs are made in there. So they're making sure they're going to look after people very well, and that's something which I'm an eyewitness to. It's not just that I only went there for a program recording. I went afterwards as well, and I've asked a few people who were outside or probably commuting within the hospital. But sir, very quickly now, obviously you have the Australia chapter, you have the US chapter, UAE chapter, the UK chapter. How do you think that people from Pakistan are watching us as of now, or because we go out in 46 different countries? So if somebody wants to contribute to the cause, how do you think that they can do that? How do you think that they can reach to the TDC?
Yeah, I think it would be very unfair to say that we are not being supported by the local community or the Pakistan. Yes, the huge number in Pakistan, the people are supporting, they are donating, they are collaborating, not only the community. If somebody is not, that does not mean he doesn't want. That I said, we need to outreach to these people. We need to sell the concept of the diabetes center in Pakistan. Apart from that, beside the local community, we are outreaching to the public sector. We recently had to sign an MOU with the Pakistan Baitul Mal.
Wow, yeah. We were there.
It's a huge setup. Now, those patients that we think are deserving, that they should be treated through zakat, so we would be sending those the bills to the zakat, to the Baitul Mal. They will be supporting us. We are in the process of signing an MOU with the Balochistan Health Ministry. So they have promised to give us a full block from from one of the Sheikh Zayed hospital. We are going to transfer it, convert into a specialized diabetes hospital.
Wonderful.
So likewise, we got an area from in Sindh also. We are approaching them also. So it has to be a public-private cooperative partnership. It's, let alone the government cannot take care of the patient. Let alone the private sector or the corporation cannot do it. It has to be a collaborative, concerted effort to address these issues, because this is the national issue.
Right.
Exactly. And thank you so much, sir, for putting it this beautifully out there for people who have contributed to this cause. And yes, at the same time, I'll still have to come back to that okay, if there are people who just, after watching the program might have made up their mind that they want to donate. So how can they reach out to the TDC?
Yeah, TDC, we have a complete, very interactive website. We have separate, dedicated accounts that they can donate. They can directly send their donation to our the various accounts. And there is a system of accountability and transparency in the hospital. Not a penny is wasted. Not a penny is wasted. I am making a comment. And I pledge to all the audience who are viewing that be assured that this is a great service, and be assured that we are going to save every penny that you pay to us.
And I think as a national broadcaster, as PTV, it is our responsibility to give platform to such sort of voices in the first place, and make sure that we give them opportunity so they can project their cause, and we've also contributed to their cause in the first place. And with that, we would like to also wrap up our segment in the first place, Shehzad, and say thank you to Meesaq sir for coming here and for having this wonderful conversation. And until next time, so it's a goodbye and Allah Hafiz and good morning.
Have a great day.